As vaccination rates in children lag, measles cases continue to rise, which is alarming public health experts. I'm joined by Texas A&M virologist Dr. Ben Newman to learn more about the virus and the status of how much more it could spread. Now, Dr. Newman, between the beginning of this year and February 15th, the CDC reported about 930 cases of the measles, but in all of 2025, there were only just over 2,200 cases. Is the amount of cases we're seeing this early into the year concerning?
Yes. Yeah, as a fan of numbers and math, yeah, that's really bad to get a third of a year's worth of cases in just a little over a month. And it's concerning the most in places that have the lowest vaccination numbers. Unfortunately, Ohio is down there. Ohio is actually a little less vaccinated than Texas right now. And when you're doing worse in vaccines than Texas, you know, yeah, something's wrong.
And you mentioned cases in Cuyahoga County in early January involving 4 kids within the same home. How contagious is the measles?
Extremely. This is the fastest spreading virus, but also one of the easiest to control. So it only spreads in clusters of people that are unvaccinated, but it spreads faster than anything else spreads among unvaccinated people. So this is really one to watch out for, but it's an easy one to prevent as well. Now, right now, they're doing a lot of surveillance on wastewater. So they're just trying to see if there's a little bit of this diluted when all the people in an area flush their toilets. And there is good surveillance for the Mahoning County area and 5 counties around there, like Trumbull, Summit, Mercer, for example. And so far, there has been no trace of measles in those. Normally, you would see it in the sewers about a week before it shows up in the hospital. But if it's already in Cuyahoga County, you know it's close and it may well spread.
And it lasts for what, up to 2 hours in the air?
Yeah, in one particular test, but essentially, if you're in the same room as a person with measles, you are very likely to be exposed, and if you're unvaccinated, you will almost certainly catch it. There are clinical signs you can look for, like there are little tiny white dots they would get inside their cheek, but if you are close enough to see those dots, you are definitely getting a face full of measles. It is a lot better for a doctor to try and diagnose those things. If you have a kid and they have little blotches and a high fever, that's a sign that something's wrong, and why not get them to a doctor if you can.
And if you're vaccinated, can you still get the measles?
That's right. It does break through in some people. It's just that it's 99 point something percent effective. And that effectiveness does wear off after a while. So people who are older, such as myself, would probably benefit from another shot. That's a thing you can ask your doctor about. It's kind of a question, would your insurance cover it? In terms of the science and immunology, it would do you good. It's just a matter of regulatory, you know, may I or may I not?
Doctor, you mentioned the symptoms, but can you run down some of those symptoms again, the most common symptoms?
It starts out with a real high fever, and that's going to be a couple of days, maybe 2-3 days after infection takes place. And then you will start to get these sort of blotches, and the little spots inside the mouth are next, like little white spots, or they sometimes say blue spots, but they look white to me, really tiny. They're characteristic if you see them, but you would not see those on everybody. This is going to work just like a cold. It's going to be spread by coughing, sneezing, and breathing in the same room as somebody who has it. And it's a disease where a person is going to potentially have the virus in them for about a week before they actually know that they are sick enough to feel something. And the virus can spread in that time, and that's why it spreads so rapidly.
All right, Dr. Newman, thank you for joining us right here at 5.
Happy to help.